Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody. Welcome back to the Medical Collective, and you are here with the host, Dr. Keisha Davis. Yes, I am here as a pathologist, a physician, a mother, and also a fitness professional. So hello. Listen, I have been going through a lot and I've been listening in the news. And what I think about is that we really need to show our transparency as physicians, because I am a real human being and life has been lifing for me, and it's been very difficult navigating being a pathologist. So I want to share a little bit about my life and a day in the life wearing that white coat. I actually don't always wear a white coat. I've always been under the premonition that it sometimes can be stifling. And so when I wear my work literally at the hospital, I'm wearing things like this. Even as far as scrubs, you'll hear that I don't wear scrubs all of the time. Now, when I have to go to the OR for a physician for surgery to do a frozen section, which I'll explain, I'm putting on a bunny suit. And my friend, Dr. Sharon, a co-host, she always laughs at me because I'm like, I'll put on a bunny suit to the bitter end rather than wear scrubs. That's literally how I feel as a physician. So we'll talk about that and a little bit more things that have been going on in my life and a day in the life. So things have changed for me. I did start out working in academic medicine, which was an 8 to 5, 8 to 6. Pretty stressful, to be honest, depending on the day, because in addition to clinical work, you also are rounding, which means if you have to round or do grand rounds, you're preparing cases to present. So that takes work to put that together. Also, because you're at a teaching institution, students come in, which are medical students or residents, and you're showing them slides and showing them cases. So a lot of the times your regular work gets pushed to the backside of everything else you're doing in clinical or academic medicine. Now I am in more of a setting of independent work and doing what is called locums. And a lot of doctors are doing that. A lot are. Locum's work to me is basically a doctor on call or a doctor PRN as needed. You remember during the pandemic when nurses were doing travel work? That's what the physician's doing. They're traveling to places that need the work. Sometimes a doctor's taking family, medical leave, what have you. They need a doctor to cover that work. Sometimes they're just short-staffed, or they have been not being able to fill a position. They need work, or there's increase in demand, and so they need a physician to come in, and that's locums. The amazing thing is that locums has become in dire need, and pathology is one of them. I've explained to you that a pathologist is one who studies disease, so we're the doctor's doctor. When a test is needed, the laboratory is the one doing the test. When a biopsy, the reading of a biopsy or a surgical procedure, looking at that tissue is needed, a pathologist is needed for that. So we are always on demand and necessary. Before, a lot of the doctors that were pathologists were contracted through the hospital or working independently or with a hospital, so that there really wasn't a need for locums because they had the pathologists. Now, pathology is in demand. I literally sometimes can get about 10 to 15 offers in different places, and most of them in Texas actually needing a pathologist to cover locums. So I'm actually in demand now, which is great. It's great, but it does also come with trying to finagle your schedule, and that's interesting. So something that I want to impress upon is that it is never, ever going to be easy, but it can be rewarding to be a physician, especially a Black woman physician. There's always going to be people trying to push you down or tell you you're not good enough or they have issues with it, but you've got to take back your power. And I think some of that is finding a way to work that best fits your needs and availability and where you're working. So earlier on, when I was working in academic, right, the prestige of working in an academic institution or the medical center comes with a lot of prestige, but it does not always yield the benefits as far as family life balance or how you're feeling. This is the truth. During that time period, the way I was working, I used to go to work and sometimes sit in my car and pray, can I please make it through this day? And towards the end, when I knew it was towards the end for the job and for me at that facility, I was in tears crying before I went to work. That is so bad. And I don't think as physicians, the work and the training you put into it, and anybody, that you should be at a point in a job where you are literally in tears going to work. And that's really where it was for me. And then something happened. I'm very, very healthy. I have migraines and I have asthma, but I don't have many chronic diseases. And I started to get chest pain. Now listen, this is just information. I hope that if you do have a medical issue, you do speak to your physician or go to urgent care or emergency. But I started to have chest pain every day. So bad to the fact that some of the doctors had to take me down to the ER. And I was literally having an anxiety attack, a panic attack from work. That is when I realized, and I think many doctors coined the term burnout, when I realized that burnout was happening to me and it's not good. It should not be at a point where I'm so stressed that my body is now taking a physical toll, to where I literally had to take time off. I had to go to the doctor and get a notice to take time off. It was that bad. Now, I don't feel that. I feel the stress of work because work can be hard. Diagnosing cancer can be difficult. But I know at the end of the day, because I'm a contract physician, I can go home to my family and I have the upper hand. I don't have to deal with bureaucracy. I don't have to deal with all the politics and the drama, to be honest, of working in a hospital where you are employed. So that's kind of where I am with my job. And, to be honest, when I look back at what, should I tell my age in there? The 15 plus to 20 plus years, of medical school, residency, fellowship. I used to say I wouldn't do it again, but I think it made me the person that I am. I have been profiled. I have been little less than called a derogatory name. I have been undermined. I have been underestimated. And that actually made me stronger. That also made me know that I don't want to treat anyone else like that. So when I am in a medical directorship position, in a position where people are working with me, I don't say under me, but with me, that I treat them with the same respect I would want. It's not easy going into work knowing that you have the talent, the ability, and you're dealing with patient care, and people don't want to call you doctor. People want to complain upon you or criticize you when you're making the same mistakes or doing the same thing as other people that don't look just like you, but are doing the same thing. It's really, really hard. And sometimes as a woman and a Black woman, I think, is it worth it? Because I'm always going to be not good enough, not paid the same rate, not trusted. But you know who does trust us? The patients do. And that shows in the data that women, Black women physicians, that patients want to see those that look like them and that truly care. And so I take that into account. I really do. So I want to walk through. I want you all to sit down, right? Sit back. And I think a lot of people think, what is a day like as a physician? And there used to be bring your child to work day, bring your daughter to work day. And my son actually used to come to work with me. And he would look at my microscope and say, the look at things. He was little, y'all, very little. And he would say, look at things. Let's do the look at things. And that was the microscope. So the day in the life of pathologists can really vary. for me, now it depends on where I'm at. So when I go into a hospital that I'm covering, I get there right before, for instance, surgery starts or surgery needs me. I am a clinical and a anatomic pathologist. So everything that comes to the laboratory is blood samples, microbiology, blood banking, hematology, all of that is dealt with the pathologist that's covering. And then anatomic pathology is if you get a biopsy done or you have something taken out, that goes through the anatomic pathology for the most part, as well as hospital autopsies. But where I'm at now, when I get into work, I'm getting cases from the OR, and they can vary, to be honest. I'm actually in a small city that is big within itself with the amount of cancers and very complex diseases. And I always tell people I feel like I'm back in residency because when I get into the hospital, I probably can get about 2 to 5 cancer cases a day and not your regular, like very difficult. Like it could be, for instance, for men that have BPH, they do what's called a TURP sometimes, and they do a resection or take out prostate chips. The majority of the prostate chips I've seen have been cancer, and you have to work those up accordingly and do a checklist for that. So I'm getting difficult cases, I'm triaging them. And what that means by triaging for a pathologist is, do I need to do additional studies? Do I need to show another pathologist? For those cancer cases that are first time, we always show a second pathologist to get a second review. And that's really for the benefit of the patient. I could imagine if this was my loved one, I would want 2 eyes looking at it, right? So you make sure when you're doing a first-time cancer diagnosis that you have a second eye agreeing with you or giving you feedback on what you should actually say for the report. So that's a large part of the day. The laboratory sometimes has issues. There was a baby, and the baby they found out had needed some blood, and they do a workup. And sometimes they find out the baby has antibodies, right? Or maybe someone has a transfusion and they have a transfusion reaction. We're looking at that. If someone is in the hospital and sick, right? And they're getting their blood done, and the machine is doing a lot of the counting, right? When the machine flags something as out of the normal range, that has to go to a pathologist, and that's called a pathology review or peripheral smear review. So I'm looking at that slide and I'm saying, okay, I agree with the tech, or I think there are what are called blasts. And blasts are an immature cell, a cell that should not be out in the blood that can signify something else going on like leukemia or what have you. So I'm looking at those things as well, making sure that if that's the case that we're reviewing that. Sometimes it's just an anemia, and for instance, one of the most common causes of anemia is iron deficiency anemia. So I'm saying what I see under the microscope and putting that into the report and releasing that as a case. So those are some of the things that happen during the day. As I mentioned before, I don't really wear scrubs, so I'm usually like this in my office. The part about being a pathologist that's different is people don't really know us. You don't see us. We don't give diagnoses to you, but your physician does. But what you can do, and I know now with my chart, is you can go look online and say, oh, look, who signed out my biopsy? It was this pathologist, and find out a little bit more. I know I do. I love to look, and something we do is I go into the electronic records and the medical records, and I look up histories that I need, and it tells a story what this patient went through, where they've been, and that actually helps me make a better diagnosis sometimes. When I have cancers that I have no idea where they come from, I look at the patient, the demographics, if they've had previous cancers before, any genetic history, family history, and that actually allows me to make a better diagnosis and an informed diagnosis about the patient. So that's something else that I do. I also do a lot of calling. I love to call my clinicians. Yes, you all. I love to call and talk to you all. Sometimes we don't understand what the stresses we're each going through. Imagine a surgeon that's in the middle of a surgery. The patient's not doing well. It's cancer. Time is of the essence. And then I come in here and they think, what is taking the pathologist so long looking at this tissue that we are doing what is called an immediate assessment on? And why can't, they be faster? And we do understand and have to understand better that relationship. They're under stress. And then imagine for us, we're taking tissue, we're freezing it really fast. And when you freeze something, even, when you put food in the refrigerator, in the freezer, what happens? Sometimes it gets freezer burn, or it just doesn't quite taste the same, or it looks a little wrinkly. That's what happens with the tissue when it's frozen. So imagine I'm looking at something in not the best quality as it would be if it's normally processed, and I'm trying to make a decision. And sometimes it's hard to do that. And they're waiting on me, and they're waiting on me. And then the tech is waiting on you so they can call, or you're going to call the physician. So there's a lot of stress going on. So I think that when we talk to each other, we can understand each other's position and job better. And it really is important for communication that we have that. So I do call and talk to my clinicians during the day. If it's an unexpected diagnosis, they expected, the GI doctor is scoping and expecting just inflammation and I see cancer, I definitely call them. If they were expecting something and it's not there, I may call to tell them, you probably didn't get it. This doesn't represent everything in its entirety. We have that conversation. If I want to find out a little bit more, or it's a cancer case, and I'm like, tell me a little bit about this patient or what you saw. It's amazing what you can do. And that's kind of how I connect more to my patient, which is my slide or my tissue, because I cannot speak to you. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Now, there are places that are working on that. There are some medical institutions that actually are doing a program where they're able to speak to the patient and show them their slide, which I think is amazing. And I hope we can do more of that. So that would even make my day more exciting because no, I don't sit in a dark room, but sometimes my room can get quiet. I put music on, or I'm watching TV, or I'm dancing, I'm moving. I have a desk that goes up and down. So I'm moving and keeping my body moving because a lot of the work is sedentary. I do walk to the doctor's lounge, talk to the people there. I take a lunch break sometimes at the hospital and sit out in the sun because I love heat. I do. I sometimes may walk the hospital. If I'm in a hospital that has steps, I like to do that. That's another thing. For those that are more sedentary, moving is good. Surgeons are always moving or standing up on their feet. So it's good you have that balance of moving up and down. And then I also make sure I'm eating very healthy during the day and hydrating. Because there was a time, and some doctors do this, we don't drink a lot because going to the restroom takes time from the work. And it's sad. I've heard teachers say that before, that they don't drink a lot of water because then they have to leave their classroom. But we have to remember we do have to. In order to function best and make the best diagnoses and be the best, we do need to make sure we're drinking and eating healthy. So I have healthy snacks next to me. I don't have, and it's funny because I remember in residency, we used to have a lot of conferences or lunches put on by reps. And I don't have that. But I do try to refrain from going to things where they're offering a lot of stuff. I know I might be tempted to eat I shouldn't be eating. But I do try to do that or find or suggest better healthy options for that. So I do that too. That really isn't a day. Some of the challenges that come up, I think, as being a Black female, and especially in laboratory medicine, where we make up literally less than 2 to 1% of those physicians, is people questioning you. And I know we hear the term gaslighting, right? You hear gaslighting. Is that you can start to question yourself. Now, listen, I do believe all of us can always be better. So don't think or question yourself to the extent that you're like, maybe I am wrong. But you should be always questioning yourself or delegating when it's out of your expertise. But don't let somebody diminish where you have come from and what you are capable of. That is where I am still having a trouble with. And I think if you lead with kindness and you lead with assertiveness, it can be better. But it's not easy. It will never be easy for us. I will 100% say that, because I've been in many situations when I look back and I've noticed the microaggressions. I've noticed the little things that I was told. I've noticed texts saying Miss Davis, because they didn't want to call me doctor. Or when I give a diagnosis, they roll their eyes or something and they're questioning me. And then I start to question myself. And we've got to stop that. But that comes with balance, and that comes over time with experience. It also helps when you're in a place that fosters that positivity. I feel it's the same thing with the patient-doctor relationship. Not everybody's for you. Not every place you work, they could offer you an enormous amount of money. But is it going to lead to stress? Is it going to lead to the chest pain and anxiety that I told you about earlier? Is it going to lead to a poor work-life balance? Then it's probably not the place. But if you're going to a place like where I'm at now, it's very, very busy and stressful at times. The people are great. The laboratory is great. They're doing their job very well. They're great at what they do. I don't have to cover up for anyone. I go into the doctor's lounge. Everyone speaks to each other. Everyone respects each other. They respect what I do. I respect what they do. That actually makes the stress of the job better. So I do believe that we have come a long way where we are respecting physicians that don't look like us and the diversity. Because let me tell you, I think the diversity is what makes us stronger. We, especially international physicians, which we've talked about before on one of our episodes, and please look at that episode, is that understanding diversity and accepting it is what allows us to learn and grow. There are some things we will see in the United States, tropical diseases, infections that are rare that are not rare in other places. And if you have a doctor that has that expertise or lived there, that helps you better. Or if you're dealing with a patient, and a lot of it could be dealing with the fact that you don't understand them, or there's a language social barrier, there's another doctor that can help you understand that situation better. So I do believe that there are ways to deal with that situation and adversity. So I'm trying to. I really, really have. I don't let the emotional, I think as we get older, I do not let a lot of things that hurt me before get to me. I am not getting to work and crying like before. The little connections that I do have with the patients bring me joy. And some of it is through talking and having lives, going onto social media or TikTok and having a conversation in a room and someone sending me a message. What you all said helps me. Now my husband's going to do this. Now I understand prostate cancer better. Those little wins mean so much to me, seriously. As a doctor that's not front-facing, having a physician or having a patient tell me those things can go a long way. So I do really, truly appreciate that. I also want to close with something called balance. And I learned this. I'm appreciative. I learned this a long time ago. I grew up in a very rural, not rural, but small town. And my father believed that was the best place for us to get a great education. But I started as a family. We were the only family that looked like us in that area. I had a hard time. I really, really did. And I think I took all of that and put it into working, where I have to get straight A's. I studied all night long. And I think that part of that was taking it so literal. There was a teacher that told me that I wasn't smart enough. I couldn't be in honors classes. There was a teacher that tried to hide my paper. And I took all of that and drove it into work, but to the excess. But as I got older in high school, I learned about balance. More diverse people came into the community and schools, which was great. I adopted music into my life. My mom took us to this foundation called the Jazz Foundation. So I took that. I started working out. I started dancing. And so I balanced all of that. And that helped me really navigate all the pressures of work. When I started to get into medical school, residency, I had the balance. And I always tell people what allowed me to make it through medical school was music and dance. Truly was. I was dancing full time. I was literally learning Afro-Caribbean dance to the extent that it's professional now for me. It's been 25 plus years. So I do believe in balance, and balance can help manage the stressors of being a Black woman physician, of being a physician, a female physician, a pathologist, any type of work you're doing. If you don't have balance, it can sometimes make the inadequacies and problems you have even more evident and more prominent than they need to be. So find that balance. That's what I'm doing. Something that also with burnout or with stressors is that it starts to affect our home life. My husband always tells me when I come home, don't bring it home. And there may be. It's why you sometimes may need to bounce things off different people. Like, I love my doctor friends. They're amazing because they get me. We're going through the same thing. So sometimes the things that I want to tell my husband, I tell them because they get it, right? And they offer you the best advice that they can give you. That's good. So having someone to bounce things off of can help with, quote, burnout. But if you're starting to really, truly feel sick, you're starting to have so many issues going on, you really need to think and step back. I did not realize that losing my job and going into locums was going to be the best thing for me. Now I can work 2 weeks a month, 3 weeks a month, and do this. Do what I know I'm destined to do, is now use my voice that's always been behind the scenes, front facing. So sometimes those things that happen to us, the stressors of being a physician, a woman physician, a Black woman physician, are sometimes going to be our positives that we can use later to share with others. So don't forget that. Don't forget that. I also think, in addition to friends or peers, role models, mentors are important. Online communication. I learned more through doing Clubhouse and TikTok from the patients than they probably think that they learned from me. Truly, truly, truly. You don't know. You learn from your patients. I learned from my kids. So make sure you're doing that. And also, as a parent, I will say this, closing. I decided to go on vacation. And while I'm on vacation, my daughter decided to take a four-wheeler without permission. And unfortunately, she had an accident and overturned on her. And she has a fractured tibia and I believe a partial tear of one of her ligaments, her ACL. And it was stressful because I was out of town and I was really, really worried about her. But I started to think and question myself, what can I do away? And you really can't do much away, right? So we have to, as parents, as mothers, teachers, whatever, realize we can't do everything. We can't do everything. And we have to sit back and breathe, and things are going to work out. It worked out. My parents are amazing. My sister's amazing. She's back here now. She may have to have surgery, yes, but I made it through, and I needed that vacation. I was like, oh, this happens on vacation, but I made it through that thanks to all my family and friends. So thank you all. So as I conclude today, I want to thank everybody for listening in. Thank you, thank you, thank you. And, we had a day in the life of a Black female physician as a physician in medicine, in pathology. So now you know. Now, I could have added on when I was back at Baylor, we also did hospital autopsies. That's a difference. We did grand rounds. We did lectures, all of that. But now this makes me happy that I'm still able to continue what I'm destined to do in pathology and still have time at the end of the day at the end of a week to spend with my family, to get on here, to get on social media and speak my truth. So we will do more of these day in the lives. I love to hear about the day in life of Dr. Dan, Dr. Leslie, and Atusa and Sharon as well. So we'll do those the next time. I encourage you all, for those that are entering medicine, reach out to the Medical Collective, reach out to us. We have many resources. We can be mentors to you. We want you to be encouraged to continue on. And as AI and digital pathology, I'm going to add on to that. What happens when I'm sitting here or I'm trying to help my daughter because now she's going to be home more, that digital pathology is going to allow me to do a different kind of day. So I can tell you when I'm logging on and what that's like, navigating that. That's now what, the meta world? How meta pathology is going to be. That'll be totally different. Also, make sure you have that balance. What tools are you going to use? Dance is my tool. Music is my tool. My husband and I just went to HotWorks and did a hot stretch session. That was amazing. Rewarding yourself with mini vacations. And that can mean many things. It doesn't mean a grand vacation somewhere. And make sure you have those mentors and peers to redirect you during that time. And a lot of the stressors we have, if we're overworking or over-focusing on them, it's magnifying them. So try to find a way to diminish those problems. And that's through balance, and that's through loves and passion. But at the end of the day, if this day in the life is not the day in the life you want to live, you're going to have to go back to the drawing board and figure out how you can make it better and change it. And you don't want to get like me to where I was pushed into a corner to realize, listen, it's not working for you, and they made the decision, and now I'm doing what I'm supposed to be doing. So until next time, everybody, thank you for being here. Have a great evening, day, wherever you shall be. And when you're listening to this podcast, I hope you're encouraged. Thank you. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.